Please join me in welcoming this morning's keynote speaker, Dr. Ali Asgary.
Good morning, everyone. I'm very pleased to be with you today. It's my honor, and I thank you for inviting me to this very interesting summit. I learned very much myself from the presentation, some of which presented yesterday. We all share information, and this is the beauty of this type of gatherings. I'm trying to provide you with some answers, possibly, about one of the key and basic emergency management preparedness activities that we do. I'm not a lawyer myself. I'm an academic. I involve in practice, of course, through my academic works, but I guess lawyers, those who make legislations, probably can use this information with your help to decide about the future of emergency preparedness as it relates to what we call it disaster and emergency kit. So before I begin, I would like also to mention about this important day, which is Children's Day. As I speak, of course, there are so many people around, children around the world who are suffering from disasters and their impacts. This case, I just mentioned an example of children who are right now living in tents like this in the winter time. This happened because of the earthquake that they faced 2 months ago in northern Iranian province. So we wish things change and we have a better future for them, of course. I think I would like to start with this idea of what we provide people with, or the messages that we are sending to people about emergency preparedness. If you look at emergency preparedness campaigns, activities, plans at the community levels, at the national, provincial levels. In most countries, you will see they are recommending these type of activities. They ask households, for example, to have evacuation plan, emergency response plan, emergency kits, in a sense, what we call it, or disaster supplies, and also ask them to maintain their emergency response plan. This is in a nutshell what we are advising people to do to prepare themselves for disaster and emergencies. But there are lots of questions about them, and I want to explore some of those questions. I think it is time, after probably 1 or 2 decades of emphasizing on this topic, to sit and ask questions, or collect those questions and to either change our approach or think what we can do next after all these things we have done. We have to assess them. We have to understand whether they worked or they don't. Can we do something different about them? These are some of the questions. But if you summarize all these questions, they come to some of our current practice. We need to question whether our current practice is correct or not, or if it is useful, effective, and efficient or not. We also need to question our methods. The methods we are using in emergency preparedness, are these the right methods? Can we think of alternative methods, and so on? And of course, there are some questions to us as academics in terms of research? Are these research we are doing good enough, helping emergency professionals and practitioners to do what they're supposed to do, or do what best has to be done? And also theories. There are lots of theories. I can tell you that there are lots of ambiguities, there are lots of conflicts in what they say and what they advise. So maybe we need to also reconsider the theories behind all these activities. So I'm trying to summarize some of these questions in here. So I intended basically to ask these questions from you before I provide the answers based on the literature, based on the practice, and so on. But I thought it would be time-consuming and also difficult to handle it. But often I might ask you to provide answers before I provide you with some of the details. So if I ask you, please, feel free to just respond or provide answers. There's no correct and wrong, but it helps the argument and discussions for this morning. So the first question, probably the basic question every one of us know or comes to our mind is, what is the name or good name or the best name for these? If you go back to government documents at different levels, different countries, you'll find lots of different names used for what probably we all know the same, that is one concept. I give you some examples. In Alberta, for example, or in Canada generally, Canadian Red Cross is using emergency preparedness kit for this concept. Public Safety Canada uses sometimes emergency kit or 72 hours emergency kit. In Alberta, you're familiar with that. Some cities and generally the province use different names. But it's not about pointing to a particular place. It's just to show there are differences, there are different terms used for the same concept. And there are consequences for that. And also in US, different organizations use different names for the same product or for the same concept. Another example. This is a document also Salvano mentioned yesterday in his presentation. This is a great document. I have no doubt or I have no discussion about the content. This is one of the greatest publications for Canadian risk management. But if you look into this text, you'll find, again, using different names, different phrases, different topics for the same concept. Ranging from emergency kit to a disaster kit to winter emergency kit to emergency survival kit, and all those different names in one document. Probably you expect, or we expect, we are sending one message to the people. I know, and probably you also know why these differences in one document comes, but of course, because this is an edited document and people have written, different people have written from different perspectives, from different communities and so on. This is obvious, but when it comes to a national type of document, probably you expect a little bit difference. And guess what? I wanted to ask you this question. If you go back to my list, if I ask you what is the winner basically is survival kit for zombie or zombie survival kit. If you do a Google search for using these phrases for different concepts, such as, for example, basic emergency kit, emergency preparedness kit, or emergency supplies kit, do them. It's a simple Google search, and also for zombie survival kit. Huge difference between the number of records you get. And these are the phrases we used. So you can see what type of names would change or would have some impacts. I'm not recommending this, by the way. It's just to say the impacts of names and differences in phrases that we use in public opinion, in the way people react to that, and so on. And also, it's not about only Earth. We also have emergency kit for Mars. It's also, again, to mention that, to add to the confusion. We have research projects bringing students and researchers to also think about what would be an emergency kit if you want to live in Mars. And this is an example of that, emergency supply kit for Mars. It's a teaching tool, of course, but it's really targeted toward if we want to live in Mars. So in a sense, people are confused, I want to say. And this confusion is reflected in research. When you talk to people, they actually say this. In some research, I can tell you at least less than half of the people recognize the terms disaster kit and emergency kit. So meaning that if you talk to them emergency kit, they understand that, they recognize that, what it is. And most have heard about disaster supplies kit or emergency supplies. Again, it shows people, depending on what term you use, they have different understanding of that. In some cases, when researchers ask people about disaster kit or emergency kit, they actually question them. What do you mean? Do you mean emergency or first aid kit? Or is there a difference between these disaster kit and first aid kit and so on? Because we are using different terms and people question that. People, generally, they are not necessarily listening to radios that is broadcasting from a city. They are listening to, CNN here and there. So that adds to the confusion. So you probably guessed what was the answer for the first question, and there are, of course, lots of other answers to that. The second question is about how many emergency kit, or from now on I use emergency kit for that same concept. How many of these families should have? Again, this seems simple question, but if you go to reality, you will see there are so many messages, there are so many types of emergency kits we are recommending to people. Give you an example. These are just a summary of what you can find in government documents, website, literature, and you name it. You have earthquake survival kit, you have hurricane supply kit, terrorism preparedness kits, flood supply kit, go on over. Some of them are interesting. You have, for example, even drought survival kit, or shelter in place in terms of functions that people need to do during an emergency. So a variety of emergency-specific kits we are offering to people, or sometimes we ask people to have. So imagine if people ask us how many we should have, or what I should have to be prepared in a way you are mentioning. Not even that, you have to go more, because you ask them also to have kits for their pets, if they have one. And these are just examples, and these are official documents. It's not, they are actually recommending that, and that's true. That's what people probably should understand and should know. But it just adds the complexity of the problem. So people also, or we can question ourselves, this is a very key question. Very key, important question. It's for legislation especially, for all of us. If you ask question, do emergency kits save life? In this session, how many of you agree with this, that emergency kits save lives? Raise your hand, please. Thank you. Probably more than half. Or some people didn't raise their hand, but probably they agree. Or let's say more than half, in my view, accept or say this. But before I answer this question or I provide you with more emphasis, I give you an interesting story that happened to me, because I was doing research on that, and I wanted to see what other people think about this. I came across one of the companies who was selling emergency kits. In their website, as you probably can see, I have highlighted this, that portion of their website here. In that portion, it says, emergency survival kits saves lives, period. That's their marketing slogan, if you like it. Okay. Then my question for this company was, I sent an email to the manager, said, can you provide me with evidence of emergency kits saving lives? Because I assumed a company, big company like that, having this statement in front page has some evidence that I don't have, because I had searched literature here and there. I have not found anything on that line. So I was interested in knowing what this company says. So let's see the answer. I've put the whole response, which you might find it interesting and also in some part funny. But this is the reality, and this is what it is exactly the case. And this is where we are confused, in fact. I just read it, probably part or all of it. This is really interesting answer. Thank you for contacting me about this. Ask, do you have, and then they said, do I have actual statistics? Answer is no. This statement that emergency survival kit saves lives, period, is based on the fact that our survival kits have the one thing necessary for life, that is water. Okay. So with this, I showed this statement to a professor who is in law, asking him, what do you think about this? First impression, or his first response was that there is a problem here, a major problem. And one thing he also mentioned was that, well, it probably means, and I mentioned that too to him when I was discussing with him, I can basically sell a bottle of water to people and say this saves your life because of this statement and because of this argument that he's making. But continue, I mean, I'm not reading everything, but he's probably is trying to discuss why and how water helps and saves lives and so on, which all of us know. And at the end, he told me, you know, if you are feeling this bothers you, I can remove that. And I responded after a while and said, it's not about me. I'm a researcher. I'm looking into what people do and try to understand the causes. But I advise you at this point, do something with this statement, because U.S. politics and, you know, we know somebody might come and sue you sometime. At least, you know, you can rephrase this to save yourself for now instead of people. So what he did quickly, he changed the website. And instead of saying what used to be emergency survival kits saves lives, he added the can in front, which is probably the better phrase, I mean, at this current situation that we are in it, without documented evidences on that. So he changed that. This was the story behind this. Now, I also asked this from an emergency manager who I know best through my contacts. This was his response to my question. Ask, do you or have you come into any situation, any report experience that can provide the statistics on emergency kits saving lives? He basically said, no, we don't have statistics that can support our claims. This is astonishing. It's not, we have had so many disasters around the world. We have sold so many of these kits to people, but there is no research telling us how effective, how useful, how they were. If they weren't, so why are we selling them? If they were, where are the documents? I mean, we need to have something on the result. So it is in part my responsibility. I'm trying. This is my next project. I'll try to go into one of these disaster impacted areas and see how much and how people are using these kits. Anyways. Another question: how people or how many people have emergency kits? You might come and say, not many, or too many. I want to shed some lights on to answer to this, or what research and practice says about that. This is, of course, after the earthquake that happened in BC, and they are showing that their stock, their warehouse is kind of empty of these bags because they sold out and they have to bring them. Okay, let's have some statistics about the current status of emergency kits at family level. In US, 2005 figures shows 31% of people who were surveyed, and I have questions about those surveys too. But assuming that those are okay, correct, these are the findings. 2006, 31%. Again, these are based on different research for different purposes. I would, for the US, I would probably accept the first group, but you can also use the second one as the base as well. Different organizations doing. In Canada, 2005, 32%, 2008, 40%. Probably US would be average the same at this point. The reason I'm providing you with information from US and Canada, it's good because we can compare the differences and similarities also. So this is the current status as claimed by surveys done in our countries. Also, I used to do this question myself. I asked in my research in the past, in my PhD thesis, I did the same research asking people about their kits. In 1996, I finished my PhD. I had the same question as these people use right now in their research, asking people if they have emergency kit or not. This is what we did recently for City of Brampton, just to give you also a local perspective on how many people have it. In our question, we asked people if they have a complete kit or some or no. These are the responses. If you put some and yes together, you'll end up with like 52% or so. So you can see at the local level. And by the way, Brampton is probably one of the cities that is pushing more into emergency preparedness and activities, as you probably know also. Another question is that now that we know 50% or 40% of people have emergency kit, how it varies from province to province or in geographic areas. I have some data for you. That's for US, which of course shows there are differences as you move across the country. In US, you see a significant difference as you move from south to north and from east to west as you can see. Of course, in Miami, research shows 70%, 73% actually have emergency kits. Why? The reason is obvious. But in Chicago, for example, they have the same research shows 32%, a big difference. This, of course, probably shows some of the variations and why these variations exist. In Canada, there is not much research, exact research like that, unfortunately, but there are some references that you can use to figure out what are the differences. In Atlantic, we have probably the most likely, or families to most likely have emergency kits. In the West Coast also, but in Quebec, always in most research is the less likely to have emergency kit, and including this survey and this report. You might ask why, and it of course talks about hazard as well as culture, society, and everything else you might consider. This is based on a particular research done just for terrorism preparedness in Canada, but they, in their survey, used emergency kits as their one of their emergency preparedness questions. Look at the results. By the way, these results are from 0 to 4, so these are the mean ratings or scores. So obviously, none of these provinces are 4. Anything below 2 means like 50% or less preparedness or having kits, in a sense. But you can see variations across the nation. Again, even in this one, we have Saskatchewan and Manitoba to have the least, and BC to have the highest level of families with emergency kits, based on this research and also for the terrorism preparedness research. So the idea is just to show the differences that exist between provinces. It probably also talks about the efforts we put into emergency preparedness from government perspective. Now, another question comes to our discussion is how much, or in fact, does occurrence of disasters change people's behavior or preparedness reactions? Probably your answer is yes, it does. And as we saw in the previous slide from US experience, Florida, those states with hurricane. But let's have a closer look at one of the studies done again in US, comparing before and after disasters. To our surprise, and this is not the only research, there are so many other research, but in most research that has been done, you can conclude that there hasn't been a very significant change in people or number of people having emergency kit after a disaster. This is based on a summary of research finding. And this is also shown in this result. Well, I say there has been changes, of course, but it is not statistically significant. It is not significant in a sense that you say one disaster would solve the problem, because people get to realize that this is what they have to do and this is what they missed. And also, it brings me back to the question that I asked. Probably it talks about the fact that maybe emergency kits are not what they are used in emergencies, if one can conclude that as well. Now, another question, how do we measure if people have kits or there is a problem here, because although we say 40% of people have emergency kits, but really those questions are not capturing the realities as much as we want. There are problems there. So when I say 40%, don't take that for granted. There are questions about that. You have to probably modify that a bit. So these are the type of question we ask in our research, and these are exactly the questions that were asked, or people were asked during those key surveys that conducted in US and Canada. Simple question, but different frame. And what I'm arguing is that the framing that we use for our questions, the type of responses that we provide to people changes the responses. This is one example, very brief, just telling if they have supply kit and or no, yes or no, or don't know. And there is another one with probably more detailed information about what should be in a supply kit, and people respond to that. I just want to say that if you give this example, this question, and the previous question to people, you end up with different answers. That's one issue here. And also, if you ask, I ask you, do you have kids in your family? They say yes. But if I ask them, what do you have in it? Many of them, either they don't know, or they come to a conclusion that we don't have kids, because they realize that this is not what we meant by disaster kits or supply kits. So the way you framed your question, how detailed your question is, changes people's responses to that. And the problem, of course, is with self-reporting. You ask people if they have kids. You don't go to actually see that and say, okay, you have it, show it to me. It is based on what they say. What they say is not always correct. Not that they are lying, but they try to avoid certain social, psychological phenomenon that exists in human nature. One is, of course, trying to show good in public face. And it's not good if I say, for example, I don't have an emergency kit while people asking you. And another question, why so many people do not have kits? This is probably one of the key research questions. If 40% or 60% of people don't have kids, why they don't? Can we change that? What factors contribute and how we can change that if we can? Let's go to this, some of these factors. And these are interesting. By the way, the columns you see, the numbers, it is based on different research. This is a summary of different research from the lowest answers to highest. So for example, when we say people consider cost to be important factor for not getting emergency kits, in some studies, there's 16% of people who have responded have mentioned this as a factor. And in some other research, 62%. So depending on where you are doing or who is your target population, you might end up different answers. But this is the range. You can see. With this, you can say cost is an important issue for people in most places. Lack of time, of course. People say we don't have time to prepare the kits and buy the kits and so on. There are some people mentioning that. Lack of knowledge, not knowing the kits exist. Despite of all these campaigns in media, in newspapers, in community works we do, still there are so many people they don't know, they haven't even heard about emergency kits we are talking about. And this is talking to that. And have not thought about this or not worried about this. So there are people who deny and they just don't want to think about that. And there are also response efficacy. There are people who basically believe this is not going to be helpful. I cannot use it, so let's not have it. Confidence in government response. This is a key issue also mentioned in our yesterday's presentations. Many people rely on government, so once they provide this, why should we bother? And in fact, responding to this factor, I want to give you an example of research conducted in Japan after the earthquake. They are now thinking of removing supplies like water and food from their emergency kit. This is a research, it's not in practice in Japan right now, but this is based on a suggestion made in a research that was done for a year. They are recommending removing foods and water from the supply kit because they say these are easily provided after emergencies. Why should we push people to have them? These are easily, I mean, the worst case scenario in Japan, if you call it worst case scenario, or one of the worst case scenario, they didn't have much problem with water and food. I mean, they were provided people with this. Nobody died because of lack of this access to these things. But that's about Japan. I mean, I don't want to generalize this. This is just a research, as I said. But it's probably responding to this factor. And there's also believe already prepared. Some people, they say, oh, we already prepared, so why I don't need or I don't want to do another item. I think I'm prepared. So these are some of the factors in research. There are also demographic factors that contribute to people having or not having kids. If you really want to emphasize in emergency preparedness kits as one of your key public campaigns, you should know about these limitations. All those factors mean that this is not going to be successful, or you cannot target or convince everybody to have the kids. Not now, anytime. It's impossible, almost with all these factors contributing. Age is also important. Certain age groups have kids, certain age groups don't, or have less. This is example. The highest 45, 54 people in surveys, usually those are the people who have said they have, and 18 to 24 those without. So, I mean, obviously it talks about education in schools as well. Race contributes to that. Employment, income, education, school, parents with young children, prior emergency experience. You know all these things. But when you put them together, we understand how difficult it is to sell such a campaign to general public, because we cannot control all these factors. We cannot make everybody rich to buy emergency kit. We cannot change people's age. They have different age group, or they are in different age group. We cannot, I mean, these are the realities. And this is also supported by the same research I mentioned about terrorism preparedness in Canada. It also shows all these factors contribute or are significant in people's differences in having or not having emergency kits. I don't want to go into details, but just to show you there are research support for that in Canada as well. Now, question comes, because I mentioned cost is important factor here. Let's see what the costs are. And that costs are important factors for certain income groups. I mean, of course, lots of, like 30-40% of the people. But let's take a look at what we have in terms of price. By the way, it doesn't mean really that people have to buy this. They can make the kits in their home using, less expensive materials. But this talks about the fact that exists in the market right now. You can search and find and get your kits from different places, different sellers. You can find it in eBay for the price of $189 US. And this is the retail price, and this is for a 4-person kit. So if you are 1 person, it's less. But this is all these figures are for 4-person. Just to give you a range of excuse me, prices. You also have $219 from Costco. You can get it from Amazon for about $200. You can get it from this private company for $140. You can get it also for, these are some of the prices. You have $135, you have $149. Example. So price ranges from basically for a 4-people kit from 130, 40 up to, let's say, 300 up more. And depends on you want, the quality, of course, it differs. It gives you just ideas. But another question that comes to our mind, and we should provide answer for that, is that, does this really mean, I mean, having a kit, emergency kit as we discussed, is it helping, or does it really mean that people are prepared? This is an important question. let's do some answer. Well, of course, in research, and as you all know, it is a significant, probably a precursor to preparedness. People who have kids or have purchased kids have some attention or have received, information, processed that, took actions, which means this is positive, this is good. But there are dangers also after that. If they feel that having a kid is going to save them or save their lives, or that is sufficient enough for them. You might say, no, this is not probably what we're advising, but this is what people think about. People buy this kit and think that this is what they need, and they are now prepared. As you can see here, these are some notes from the research and also the reality that you face. In interviews, some people actually said, I bought this $30 kit, so I'm okay. This is $30 is, of course, for a one-person kit or basic kit. So they really think that they are prepared with that. Now, 90% of people, because research, we continue asking people more questions. When we ask them, do you have kids? We ask them some more questions. Of course, one question is, how much prepared you think you are or your family is? And we ask them to answer from range of 1 to 5 or something. And in most cases, like in this example, 91% of people who purchased kits, they say they are prepared. They believe that they are prepared. Interesting. But even if I ask you, having a kit does mean 90% emergency preparedness, you might say, no, it's not really what we think or what we believe or what we want people to believe. Now, let's also talk about this huge campaign that we had in the past few years, what we call it emergency 72 hours, is your family prepared? All provinces were involved. Federal government was involved in promoting this, which is good, and it's part what we should be doing. But let's see and evaluate and assess what we actually did, what we could do better, and if it has made any change to our communities. Of course, we do this because it's supposed to do some changes. If you look at the Public Safety Canada report on plans and priorities, in fact, in the expected outcome of this campaign, what they clearly mention is that if you want to measure the results of this campaign, one of the outcomes, one of the results that you can measure it would be number of Canadians with emergency kits. Okay? So we did this campaign. Now we are in a point. We want to start measuring it, how much change it made. Let's see. I'm not using independent research. I'm using Public Safety Canada findings and report itself. Basically what it says that this campaign has slightly increased people's having emergency kits over the time. Almost 8%. So if you say for 8 years or whatever, I'll just say 8 years, 1% each year. And this is true in every public campaign in this regard, in other parts of the world. And in other things people do or want to increase. Usually these public campaigns change 5 to 10%. And this was known to us even before we start this campaign. It is not a question about we didn't know that this is going to happen, but this is what we knew about this before. And this is what you can see in terms of graphs. Slight change in this, but not much really. And this is not surprising for a researcher, because that has been mentioned before. Now, This is also, no, I'll skip this one. This is based another example of another research done in US, not here, through a public campaign that they had at the local level. Again, it shows that they spent a lot to promote this idea in their communities, but it changed at the end something like 12%. Now, I made a simple calculation. I am not saying that this is really best way to go for it. Just simple calculation to show what we did and how it worked. You might argue about the numbers. I can change these numbers and reduce the amount of money we spend. Everything you want, I can do that to lower the numbers, but conclusion is the same for the reasons I mentioned. Just for 3 years, from 2008, let's say 2011, if you add up all those we spent on emergency management, which targeted basically these campaigns, and particularly this emergency kit, we spent, let's say, over $6 million on this campaign and relevant parts. And if you divide that by 100, that is an average. Let's say, it could be less, 100 average dollar value for a wholesale price of these kits, the best kits, let's say. You end up with like 6 million, meaning that you could buy 6 million kits and give it to people instead of all these media campaigns. You would end up with having half of the Canadian families with emergency kits. Most probably those 50% that didn't have it. And you can play with these numbers, of course. If I reduce this to 300 million, still the result would be significant. So it's just a simple calculation. I'm not that naive to really rely on that and make my case, but this is an overall view of what we could do differently. I'm not even advising that we should have given people this necessarily, but it could be an option. But of course, this campaign has had significant changes in people awareness. We can see that. Research shows that. We talk to people, you understand that. This is significant. We should admire this from this angle. It has, people with kids has not increased that much, but more and more people know about emergencies, which is good. And the survey results also shows that. But this is in part, we should be careful about this. We shouldn't, it probably, it's a kind of overestimation of the outcome in that regard. Now, finally, we go back to the key question. And I just want to summarize what I mentioned or answer to the previous questions to answer this. And this is, as I said, this is just some overall understanding that we have. I cannot claim that I have best answer for it. These are just some suggestions. If you go back to what we did in the past, and if you measure people preparedness level, what they have in home, based on those that are mandatory and those that are not, you see a significant difference. Of course, people with the smoke alarms are now 94%, and people with disaster supply kit, based on some other research, is 22%. And carbon monoxide is 60%. People get to realize more that not having carbon monoxide is dangerous, alarm. So they get to purchase that. They haven't probably realized that as much in disaster kit. So compare this. This talks probably to us that if we can, it's not that we can, but if we can make it mandatory in one form or another, probably we can increase that to the level that we want. But is this the solution, or does it work? Needs to be seen. I asked in a research that we did, again in Brampton, just for curiosity to see what people think about this. I asked people exactly this question. Having 72 hours emergency disaster kit in each family should be mandatory, just like fire alarms. Are you strongly disagree, somewhat agree, or completely agree? These are the responses. Well, to some extent, it shows there are some public support, but this research is not enough for that. If you want to do it, you have to do it at the national level, or maybe if you want to do legislation in a province, you should do it province-wise and see if this can be applied or what people think. But this is just to start with. I did in Brampton and asking people. In theory, of course, this is good. If we can make a legislation that mandate people having emergency kit, it helps. It prepares people. Emergency response would be easier and so on, as we discussed it before, and as it is the rationale for us telling people to have emergency kit. But in practice, there are lots of problems. Some of those, of course, comes out of the responses we made to those questions. In part, acceptance by the government, by the politicians, by the people is not easy. Proving the concept is difficult, as I mentioned. We don't have a proof for it. We don't have evidence of these kids saving life, really. We might need to have legislation that are regionalized. In different provinces might have different mandates and different types of kit, different standards. Standards is an issue here. And how to enforce it is a big problem also. Having a kit is, of course, people can probably comply with that, but whether they stay with it, update it, change the supplies is not an easy or something that we can change. There are some options. If you think about it, you'll find ways to solve this and make a kit that can be mandatory. But at this point, probably my short answer to this question is no. We can't probably make it mandatory at this point with the information, with the situation that we are in it. But with the fact that people not trying to have it, if you want them to have it, one way would be to mandate it. I mean, this is if we think this is absolutely necessary for people to have. There is no way with the current social behavioral factors that people have to convince ourselves that people have. Before I conclude, I also want to briefly introduce our program to you, which might be helpful in a sense. At York University, we are now the largest. We have the largest disaster and emergency management program at York University in Canada. We have undergraduate and graduate programs in disaster and emergency management. We have a professional certificate. It's undergrad professional certificate, bachelor degree started in 2010, and master program started 2007. I'm glad, I'm proud to have some of those graduates actually here with you and contributing to disaster and emergency management in the province. Jonathan, Shem, Mark, and Ashley, most of them are among you, and these are some of the graduates of York University Emergency Management Program. We have partnership opportunities with different organizations. We do run seminars on disaster forensic and lessons learned. We did on Haiti, we did on Tohoku earthquake, as well as we are going to have our next one for a mall collapse in Elliott Lake next March. We do partner in emergency exercises. We send the students to our to different exercises in the province. And of course, we can do that here if you like. We do some virtual emergency exercises that can be a good training tool as well. We invite guest speakers from different parts of the country. We hope to have some of you presenting to our students from your experience. Some of the presentation made yesterday was great for the type of guest speakers that we have. Internship is very important for us. We send the students, our final year students, to different cities, different places, different organizations. These are master students spend about 240 hours of work in an agency, helping with them. We send them around the country, and they found that the agencies themselves, they found the support and thing that they get from students is very helpful, very useful in what they do. And of course, it is a win-win situation. We are very open to sending our students as interns to your agencies. If you need experts or students who have the capability of doing work with you, let us know. We have that course. We also do have course-related projects. If you want to do a small project in your community, you don't have funds, send your request to us. We can do a research for you at a limited level, and we can help. Some of those research we did, or I actually use in this research, are based on those research projects we did through a course with cities interested in doing research for them. We also do research, larger scale research. We would be happy to help on that. We have international partnership now with several universities in Europe, and we organize different field trips and training programs with them. And we hope to establish our PhD in the near future and create more specialized disaster and emergency field. So it was a brief introduction about our program as well. I hope if you are interested in sending your colleagues, your staff, or even your own children to disaster and emergency management field, York University is a place where has this emergency management as a discipline. With that, I conclude, and I thank you very much, all of you, for bearing with me and listening to this. I hope you found it helpful. And if there's any question, I would be happy to, of course, answer. Thank you very much.
So we have time probably just for one quick question. We don't have a lot of time before we move to the breakouts this morning, but if there's a question for Dr. Asgary, I have a mic here, and Pat on the other side of the room has one too. Okay, I noticed one there, Pat, in the, just keep going. Maybe raise your hand there so Pat can see you.
Good morning. I'm wondering if, as an academic, you think we might be targeting I'll call it the wrong audience, and we should perhaps focus our attention on package preparedness to the children as opposed to the parents. And it'll be a thing that occurs over time, much like we did with hockey helmets and bike helmets. You know, you target the kids, recycling programs, they grow up with it, and it becomes part of the normal culture.
Very good question and very good option as well. In one of the studies I mentioned, this has been mentioned that there is usually families that have children in schools. If schools provide emergency preparedness activities and training, teaching in their curriculum, the families are more likely to have kids. But this is, of course, one portion of the community. Within those kids, some of the parents already have kids, and some don't. So in part, in response to your question, yes, that is a long-term solution, and we should go for it. We should continue doing that. And if we haven't done, we should start doing this. But if it is going to help or solve this problem completely, not. We probably need to do the same approach in other targeted communities or group of people. Thank you.
Okay, thanks. I'm going to call Craig Mahofsky up. Craig is our Manager of Strategic Initiatives. And Dr. Asgary, I'll just get you to wait there. Craig has some words of thanks for you.
Well, good morning, everyone. Dr. Asgary, on behalf of our delegates and my organization, I'd like to thank you very much for joining us this morning and sharing your insights on family emergency preparedness kits. As someone involved in the legislative and policy development process, I certainly appreciated your presentation, both for its searching questions as well as for considering some possible options and tangible approaches to building family and individual preparedness. I also really appreciated your in-depth research and analysis. It certainly challenged some of my basic assumptions, especially in relation to changing behaviors through public education. And I certainly look forward to carrying this conversation forward into my daily work, as well as in some discussions with my colleagues. I know this is something we're certainly very, very interested in. So again, thank you, Dr. Asgary, for joining us this morning, and I will certainly be looking forward to following up with you in the future. Thank you.